we have kind of a treat today. The people who are really on the front line in regard to coronavirus are our health commissioners. They're the ones who are out there. I talk to them and listen to them mostly every Monday morning, early morning call, and I learn so very much from them. This is really a partnership that we have with them, but 113 separate health departments around the state of Ohio. First, I'd like to introduce you to Charles Patterson of the Clark County Combined Health District. Charlie has been Clark County Health Commissioner for the past 20 years. He has more than 31 years of public health experience at the state and the local level. So Charlie, thank you very, very much for joining us.
Thank you, Governor DeWine.
Let me just maybe look a little bit at Clark County, and maybe if you could just kind of tell us how this has evolved, maybe going back to at least when we started the color code, and kind of tell us what the evolution has been and maybe where you are today.
Well, we started with the orange color code. After about 2 weeks, we moved up. We had a few weeks of red, back to orange, and then last week, due to our current circumstances, we're back at the red hazard level. We started basically with businesses and employers, especially those essential employees that had to go to work every day. As the schools were closed and many other businesses were, these folks weren't allowed to stay home. And so they passed that along, and several large outbreaks, including at Dole. We had some outbreaks in manufacturing and warehousing in Madison County that affected our community as well. At this point, we're seeing it in the general population, and unfortunately, that now is starting to affect our nursing homes. And the one way we're knowing that it's affecting the nursing homes is because the National Guard testing that's going on, it's a phenomenal program. We're seeing the employees tested every 2 weeks. Unfortunately, with that testing, we are starting to find the indicators of employees and now residents at our long-term care facilities being affected.
So in your case, you were actually seeing kind of community spread then move into the nursing homes. Is that kind of the
Absolutely. We had we were seeing 55 cases a week or so, and now that's moved into the nursing home long-term care. That's bumped us up to more like 75 to 80 cases a week now, with those residents and employees being affected.
And talk to us a little bit, Commissioner, about the start of school. Clark County, you have kind of, some schools are remote, I think, and some are in person, maybe some are hybrid. How do you handle that, or what do you see going forward? Because I know that the partnership between you and the superintendents, you and the schools, is a very, very important partnership as schools start back up.
Well, we do have a great partnership with our superintendents, but as you know, local control is very important in Ohio, and local school boards have chosen the entire gamut here in Clark County. We have a couple of districts that are fully remote. We have a couple of districts that are doing the hybrid, and a couple that are going back to school full time. Each of those districts has a plan in place to try to keep those students and teachers in school as long as possible, and we'll be very closely monitoring that here in Clark County to make sure we can keep those schools open. One of the things that we have to be very careful, though, is personal responsibility of all of our citizens, because just as we've seen it affect our long-term cares, we know that if people are not following your guidance with the social distancing and the masking, we very quickly could see this transmission in the schools, and then we'll have to work closely with the superintendents that are in person to see if we can continue that.
How are we doing in Clark County in regard to social distancing and wearing masks out in public? Do you have any anecdotal, what you have seen, maybe what your health department's seen?
Well, we've certainly seen a lot more masks on individuals since your mandatory mask order. But I would tell you that the number of complaints we're getting has also risen because of that. People want to go to a store, they want to go to a place of business and feel safe. and they only feel safe if everybody's wearing masks. So we still have enough people not following the guidance that's throwing our numbers off, and that's why we continue to battle this in our community.
Maybe a last question, if we could go back to the schools for a moment. Just as the nursing homes many times will reflect, the community spread, certainly schools are going to, and do, those that are open now, reflect the community spread. What's the procedure? What's the procedure a school follows if, let's say that, they have some indication they have a student who has some of the symptoms?
Well, the first thing that will happen is the contact tracers at the health department will work with the school districts. We have designated people at each of the school districts that we'll be sharing information with. The school nurses are very vital to this effort moving forward. And we'll look at seating charts. We'll see exactly who has spent that less than 15 minutes or more than 15 minutes, less than 6 feet away. And those individuals who surround a positive case will be quarantined. The positive cases will be isolated. And we won't look at an entire class. If we can, we'll leave as many kids in place as we can. But those individuals who are affected, we are going to have to make sure we stop the spread by that quarantine order.
Well, Commissioner, thank you very much, not just for being here today, but thank you for what you do to keep Clark County, the citizens of Clark County, safe. And we want to thank not only you, but your whole team. You've got a great team there, and we just appreciate, we know you guys are working really, really hard, and this is, there's no let up in this. So thank you for what you do. Thanks for acknowledging the team, Governor. They're doing yeoman's job out there. They are indeed. Thank you. Thanks a lot, Commissioner. Let's go up north to Medina. I'd like to turn to Krista Wasowski, Health Commissioner at the Medina County Health Department. She's been a Health Commissioner for 15 years, past 8 of those in Medina County. Before that, she was not too far away in Morrill County. She has 28 years of public health service. Medina was red for 3 weeks, July 23rd and the 30th and August 6th. Commissioner, you want to kind of, first of all, thanks for joining with us, and can you kind of maybe give us, as Charlie did, can you kind of give us the rundown of where you are in Medina County now and kind of where you've been, how you got there?
Sure. Thank you, Governor. So Medina County, since early June, actually, we've only had 17 COVID cases coming out of congregate settings. We too have had the Ohio National Guard in here doing testing, a lot of testing happening within congregate settings. But the cases that we're seeing in Medina County are really coming from community spread. So to give you an idea, back in May, we were seeing 14 cases a week on average. And then in July, we were seeing 74 cases a week on average. And now in August, we're seeing 85 cases a week on average. So while Medina County has never been designated as a high incidence county, even the weeks when we were red, we do have some communities in our county that are having more significant spread. So some of the challenges that we're having are people giving complete contact lists to us. I think sometimes when people have a mild illness, they don't really want to inconvenience their friends. But really, contact notification and that tracing process and working with public health is really the only way that we're going to get in front of this virus. We want people really to remember that the virus, it may be mild for you, but it might not be mild for that next person. Really, to Commissioner Patterson's point, those cases that ended up in the community and then finding its way into his nursing home, they've actually had some rather tragic outcomes from that in his county.
You talked about different parts of the county. Where do you see it most?
The northern part of Medina County, our border that's closest, we're a suburb of both Akron and of Cleveland. So it's our northern end of our county where we're seeing more of our cases and community spread.
And talk to me a little bit, if you can, about the opening of schools and kind of what your relationship has been with the different school districts.
Sure. work very closely with all of our superintendents. I had a call with them just prior to this call. So as in Clark and many of our other counties, people have different plans. The beauty of local control is that those local plans are in place, a lot of safety protocols, but really our ability to keep our schools open and to keep our students playing sports and doing extracurriculars really rely on us being able to contain this virus.
And talk to me a little bit about how you're seeing this occur. You talked about community spread. Maybe anecdotally, what as you trace these back, and I understand we can't always trace them back. Sometimes it's out in the community and you just can't really figure out. But are you seeing, when you do trace it back, what are you seeing?
Yeah, sure. What we're seeing is a lot of unintentional exposures. You know, some of our young adults in particular are having mild symptoms. It seems like a cold to them. And so they think it's okay to maybe go to sporting events or to work or to other social gatherings. And then once their tests are coming back, sometimes they're surprised that they have COVID and that they've infected other people. And so what we really need across the state, we need with our schools opening, really for parents to be willing to kind of step in and keep kids home and keep their friends away while we try to contain the virus. So I know everybody's anxious to get back. I mean, we are all anxious to get back and to see one another, and it's exciting to have school back in session, but those safety protocols that we put into place at sporting events and in school, those need to carry over into the other interactions that our kids are having outside of the school if we want to keep our schools healthy.
Maybe walk through kind of a hypothetical case. Let's say it's a young person and they have symptoms, or let's just, maybe it's an older person, they have symptoms. What should they be doing? They go in, and let's say they take a test. Let's get them that far. They take a test and they're waiting. So what's the protocol? What are they supposed to be doing then?
Yeah. So what we really need to see happen is if there's that level of suspicion, either on the part of the person to seek out testing or to have a doctor prescribe that and to have that occur, is really for that person to assume that their test is positive and to really isolate themselves away from other people, and if possible, ideally away from other people even within their household, to contain that and to not have other people also become positive. You know, a lot of times people want to believe that they're not sick and it's not COVID, and that's really where we're seeing other people becoming ill, because folks are kind of living their normal life and doing what they would normally do while they're waiting for that result to come back. So we really need people, if you are waiting for your test results to come back, truly staying at home and staying away from other people is you being a really good friend, a good neighbor, and really a good coworker.
And your time counts right during that period of time, right?
It does. If you're symptomatic, the time that you're spending at home in isolation, that counts towards your total isolation period that public health will ask you to stay away from people. So you're just sort of getting a jump start on that. And you're also keeping that list of contacts very small if you're staying home and away from other people.
So we're part of the way in this. We're not quite sure how far, but you've been battling this for some time, you and your team. Tell me the future in Medina. What do you worry about? What are you optimistic about? Just kind of, you don't have a crystal ball. I don't have a crystal ball, but kind of how do you see things in Medina?
Yeah. So I'm very optimistic. We have the Mask Up Medina campaign. We're seeing more masks being worn to the point that Commissioner Patterson made. People are expecting to see masks when they go into places as a safety measure. So I'm very optimistic about that. Some of the things that concern me are that spread that we're seeing within our younger citizens. We really need to get ahead of this, and we need to get ahead of this before flu season starts. That's for sure.
And getting ahead of it means what to you?
to me, it means keeping one person who's ill, keeping that number that they also get ill very, very small. So back in the beginning, our list, we only had maybe a one contact and very few, a little bit of disease spread. But as we come up now, we're having 10, 15, many contacts. And so that just exponentially potentially spreads that disease. So when I say get in front of it, I mean all of us being very responsible to really to one another. And if we're feeling ill, staying away and containing that illness.
Well, Commissioner, thank you very much. And also thanks to all your team, the Medina Health Department. Thank you. We appreciate what they do. We know they're working long hours and tough, and you know, the end is not in sight. It will get here, though. We know that, and but we thank you and thank them.
Thank
Appreciate
you,
it
Governor.
very much. Thank you.